Patient Zambrano. Patient Zambrano.
Yes, ma'am.
Hi ma'am, good morning. My name is
Morning
Lateral,
po.
yes, and I'm going to be your red tech for today. Can I have your full name, ma'am?
Zyril Marie R. Simbrano po.
Okay, hi Miss Zambrano. Ma'am, ask lang ako pa-confirm ano sa middle name ninyo?
Reyes po.
Okay. And ma'am, kano sa manimuhang birth date and kano sa manimuhang birth date and pila na ang edad nimo karon?
Kuan, ma'am. March 8, 2000 po. Tas 21.
Okay, 21 na ka. Ma'am, unsay preference language na to para mas comfortable ka?
Kasabot naman po Bisaya, ma'am.
Okay. Sige, ma'am, Bisaya na lang ta. So, ma'am, kano sa mga last gidugo?
Last week, ma'am.
Last week pa. Ma'am, naa kay request ni Doc?
Kani man to, ma'am, no?
Oo, ma'am, sige. So, ma'am, noon sa day ka, ma'am?
Right. Sa tagak mo ko sa agdanan, ma'am. Tapos akong dali o ang
Okay. Sakit diha, ma'am, no? Sige lang, ma'am. Kay, nakita naman ako ang request ni Doc and na-confirm na ako tanan. Ma'am, bali mag-ilis na tag-patient ka dito sa kilid na ilisanan dito. Balik na lang, ma'am, ito man ka, ha? And also, ma'am, pa-remove ko sa mga metallic objects naas na naakaroon sa imuhang body. Ha, ma'am, ha? Salamat.
Yes, ma'am.
Good morning. My name is Nikki Reyes, and today we will be having a return demonstration of AP projection of the femur as well as lateral projection of the femur. Right now, for the AP projection, we will be using 14 by 17 for the cassette, and for the SID, we will be using standard, in which it will be 40 inches. So now we will be placing the cassette below the x-ray table, assuming that this is an x-ray table. I will now place it to the center. Okay. Okay, so ma'am, mo man nakag-ilis, ma'am, no? Patient gam, comfortable ka, ma'am?
Yes,
Sige,
po.
ma'am, higda na tatira, ma'am. Okay. So, for the patient position, make sure that the patient will have a pillow for its comfort, and the patient will be in a supine recumbent position. So, for the part position, first let me explain. For the part position, align the femur to central ray and midline to the IR. So, we have to ask the patient to adjust and position at the midline of the table to have more correct position. So, please do not forget to internally rotate the leg of the patient 5 degrees. So, ma'am, i-position ka, ha? Ma'am, comfortable ka na, ma'am, no? Move lang ka sa middle sa table, ma'am. Okay? So, i-rest lang imong tiil, ma'am. Ana, sige ka na. So, right now, the patient is at the midline or perpendicular already to the midline of the table as well as to the IR, which is located below the table or the bed. So, again, make sure to rotate the leg or the feet or the leg of the patient 5 degrees to achieve true AP projection. And in positioning the patient, make sure that the knee joint and femoral joint will be included in the IR by considering the divergence of the X-ray beam. So, right now, let me show it to you. So, let us rotate the leg 5 degree. So, internally, ma'am, pa-rotate lang ko sa leg, Ana. Okay. Ma'am, relax lang. And then, in the collimation, we need to make sure that the knee joint as well as the femoral joint. So, again, knee joint and the femoral joint. So, Ana, ma'am, sakto na. Okay, so, ma'am, okay na ka, ma'am, no? Relax lang, ma'am. Okay, so we will now collimate the anatomy of interest. Okay, so we will now proceed to the collimation, but before that, we should put or we should not forget to put a shielding for patient's safety. So, ma'am, magbutang kog shielding, ma'am, ha? Kani kay para sa imuhang protection for x-rays. So, we will place it here. And then, we will now put the marker. Okay. We will adjust it later. Okay. So, for the central ray, make sure, or for the central ray, okay, so for the central ray, it should be perpendicular to the femur and the IR. It should be directed to the midpoint of IR, in which we need to make sure that the femur and the IR are perpendicular as well to the part and the IR itself. For the collimation, make sure to include only the anatomy of interest. So make sure to collimate on the four sides of the anatomic part, and make sure that the knee joint and femoral joint should be included on the light field. So we will now collimate the anatomy of interest. Okay, so again, the central ray will be directed on the midpoint of the IR. So since the collimation that we are doing right now, or we are using, cannot be controlled manually, assuming that we are collimating only the anatomy of interest. So okay, now that the central ray is on the midpoint of the IR, as well as the knee joint and the femoral joint is included as well, we will now ask the patient to not do any unnecessary movements. So, ma'am, ay naglihok, ma'am, ha? Kay mag-shoot na ko. 1, 2, 3, shoot.
Anatomy demonstrated. So, the distal 2/3 of the distal femur, including knee joint, is shown. So, knee joint space will not appear fully open because of the divergent X-ray beam.
Okay, so now we will go ahead and proceed for the lateral projection of the femur. So again, patient will be in a recumbent position. So IR size will be the same. We will be using 14 by 17. And for the SID, we will be using 40 inches as well. So for the patient position, ask the patient to do the lateral recumbent position with the affected side down. So instruct the patient to do or assist the patient if necessary. Take note that do not try to ask the patient this position if the patient has severe trauma, or just make sure that the patient will not have a hard time on positioning. So, okay, right now for the part position, ask the patient to flex her affected knees in 45-degree angle, and to place the unaffected one behind the affected leg to prevent over-rotation. So, right now, if the patient is already in a supine position, so ask the patient to move. Ma'am, okay lang magunit ko, ma'am. So, ma'am, instruct ka, ma'am, ha? Tagilid, ma'am. Okay. Ana, ma'am. Sige. Tapos, sige, ma'am, itagilid pa yung body gamay. Okay, kana, ma'am. So, comfortable na ka, ana, ma'am, no? Pagunit na ko diri, ma'am, ha? I-flex na ko gamay mo ang tiil. Okay. So, again, position the, or angle the leg of the patient 45-degree. So the other leg will be in support. Okay. So okay. So for the central ray, it should be perpendicular to the femur and to the IR, which will be directed to the midpoint of the IR as well. Make sure that the femur was aligned at the center of the table and perpendicular to the IR. And if not, adjust. So right now, assuming that the IR is already perpendicular with the anatomy of interest as well as the table and the central ray. So, ma'am, okay na kaana, no? Make sure to give the patient shielding for patient's protection. And make sure that we will collimate closely on both sides to the femur with the end collimation to the IR borders. So, mag-start na ko collimate. Ma'am, ay lang lihok, ma'am, ha? So, again, for the central ray, it should be perpendicular to the femur and to the IR, which will be directed to the midpoint of the IR. So, right now, we will collimate the anatomy of interest. Okay. So, don't forget to put, don't forget to put the marker. So, we will now put the marker. Okay. So, make sure again that the IR as well as the central ray and the anatomy of interest is perpendicular to each other. So, now, assuming that I have collimated the anatomy of interest correctly, and, ma'am, mag-shoot na ko ha. Ayag laglihok, ma'am. Steady lang. Okay. 1, 2, 3. Okay, 1, 2, 3. Shoot.
Anatomy demonstrated. Proximal 1/2 to 2/3 of the proximal femur, including the hip joint, is shown. Proximal femur and hip joint should not be superimposed by opposite limbed. For the collimation, make sure to collimate closely on both sides of femur and as well as to the IR borders.